You with Pikasisa's Healthbeat. I'm Mia Malan. Thanks for joining us. Measles, whooping cough, and diphtheria. South Africa has seen cases of all these diseases in the past 2 years, and in some cases, outbreaks. The diseases have one thing in common: they can all be prevented by vaccines. The World Health Organization says globally we've seen the biggest drop in childhood vaccinations in 3 decades. This is mainly due to the COVID pandemic. Many babies born during lockdowns weren't vaccinated at all, and conspiracy theories about vaccines have made some parents less willing to vaccinate their children. The 2023 State of the World's Children report reveals that the perception of the importance of vaccines for children declined by almost a third in South Africa after COVID. With me to discuss this is Professor Anne von Gottberg from the Center for Respiratory Diseases and Meningitis at the National Institute for Communicable Diseases. And thanks so much for joining us. What is happening with childhood vaccinations in South Africa?
I think we know that there was a big challenge during the COVID pandemic, that it was difficult to get to clinics weren't fully staffed, it was difficult to procure vaccines. So we know that vaccination coverage has gone down during those years. And we know that also that I think it's taking time to come back right. We have to think of the children that didn't get the vaccines during the pandemic. And trying to catch up, trying to get those children to present to clinics so that we can catch up their vaccinations.
And would those children be babies born during COVID?
Yes, because remember, so our vaccination schedule starts at birth. So children that weren't born in hospital, hopefully most were born in hospital. Anyone who then at 6, 10, and 14 weeks, it's really early. Wherever they were, whatever they were doing, depending on how difficult it was to get vaccines, those are exactly the children throughout that time period. And to catch up is not complicated. It's more important for them to come to the clinic to say, I didn't manage, I didn't get to the clinic, I couldn't have my child vaccinated. And then it's a little simpler if they're older children. We can see, oh, they missed all those vaccines, but sometimes it's only 1 or 2 doses that they need when they're older.
So we've seen measles outbreaks and we've seen cases from some other diseases. Can you tell us a little bit about this?
So we've seen the measles. The measles we could have almost predicted because measles requires a very high vaccine coverage. So even without the pandemic, I think we knew that we were going to collect enough children that were unvaccinated simply because we don't have 100% coverage and there's no 100% effectiveness for the vaccine. So we would accumulate children that were going to be susceptible to measles. And that happens every few years. And then we have an outbreak and we sometimes can predict it and sometimes we can push the vaccine coverage to make it a small outbreak. So we knew that measles was going to be the one disease that was going to be almost a sentinel because it's so transmissible. It's a respiratory virus. And that happened. So we had our measles outbreak, and all the provinces have had measles cases. Interestingly enough, we've also seen pertussis, and that's another vaccine-preventable disease.
And for those of us who don't know, what is pertussis and how do you get it?
It's one of those old ancient diseases called whooping cough, and it's a bacterium. A bacteria causes it, and it's again a respiratory pathogen.
We're talking about catch-up with vaccines for children, but during COVID, we also heard about adult vaccination. Everyone needed vaccinations. Are there any vaccinations that adults need today other than COVID?
Well, I think influenza is a very good one. The virus that comes in winter, and we often say people at risk should be vaccinated against influenza during the winter or just before the winter period starts. The vaccine becomes available. There is an influenza vaccine also in the public sector available for people to present to clinics to get. So pregnant women are also going to be offered vaccines that will be protecting the infants that are born. At the moment, the discussion is that pregnant women will be offered pertussis. So with the pertussis outbreak, in fact, I think in many provinces there was discussion about, well, what can we do? It's the very young infants that die from pertussis, and how do we prevent this before they get vaccinated? So even the most conscientious parents would not have been able to protect those children because it's before they get vaccinated. And so the thought is to vaccinate the mother then protects the infant before they get vaccinated.
Now, during the pandemic, vaccine hesitancy became a phrase that we all got to know. How do we address that?
By taking it seriously and listening to people's concerns. I think we have to hear what people are concerned about, what their questions are.
Anne von Gottberg, thanks so much for joining us today.
It was a pleasure.
After the break, cervical cancer and vaccines that can prevent it. Stay with us. Welcome back. You're watching Healthbeat. The most common cancer among Black South African women is cancer of the cervix. But there are vaccines that can prevent it. It's caused by a virus called the human papillomavirus, or HPV. The virus is almost always transmitted through sex, so it's best if jabs are given before people get sexually active. South Africa introduced a cervical cancer vaccine program in government schools in 2014. Grade 4 girls or those of 9 years and older get 2 shots for free. But COVID-19 made the program lose steam. Between 2014 and 2020, the number of girls taking the first shot dropped by 80%. Our reporters went out to see what the Gauteng Health Department is doing to get the program back on track.
Sister Tebogo Seleka is a reproductive health nurse at the Temba Clinic in Hammanskraal on the outskirts of Tshwane.
Mo kgweding ba batlang mo tleliniking ba tlela cervical cancer ba bangata re na le plus minus 100.
Usually, her days are filled with appointments for routine pap smear tests to detect abnormalities. But lately, she finds herself spending more and more time telling people they've got cervical cancer.
Di patient tse ke di bonang di result tsa bona di se right ke khona bona plus minus 10 tsa di patient tse leng hore ke a di referela ko hospital.
Sister Seleka wishes all young women would be vaccinated to protect them against the human papillomavirus that causes cervical cancer.
HPV vaccine e etsiwa ko dikolong. Go na le bosister ba school health ba ileng hore ba fa HPV vaccine mo baneng ba basetsana up to 15 years.
In 2019, 360 public schools in Tshwane aimed to vaccinate more than 22,000 grade 4 girls with this 2-dose vaccine. In the end, only about 15,000 girls got both jabs, missing the minimum target of 80%.
Di COVID ha ne di le teng di disturb-ile haholo mo ho fiweng bana di vaccine tsa HPV, but ba khona ho catch up.
Temba Clinic is helping parents understand how HPV jabs can protect their daughters from getting cervical cancer when they're older.
Ha go na le di parents meeting bo sister ba ba teng ba fitla ba ba tlhalosetsa gore go iragalang.
Research shows that parents and guardians have been reluctant to sign consent forms for HPV vaccinations, especially after the COVID pandemic.
Nnile le matsapanyana mola le mola ka lebaka la COVID ba nagana gore gore bana ba bona ba tlhabiwa di vaccine tsa COVID. Whereas ne ba fiwa HPV. So ha ba bua ka tsona ba re no, is a no. O ka se mo hapeletse go motlha.
Sister Seleka tries to spread the word amongst parents that cervical cancer can kill. In South Africa, more than half of the 10,700 women diagnosed with cervical cancer each year die from the disease.
Hapa hape ke a tswa ke a emella ke a go bona ke a ba educate or guys go na le ntho eso e leng hore e botlhokwa thata mo mosading o mollo o mo, then wa ba bolella ka yona wa botsa di side effects o ba botsa botlhokwa ba gore ba tshwantse ba itse o tlo ba wina ha ona hore ba ka opala.
The Gauteng Health Department will do their next round of HPV vaccinations at schools in September and October.
You're watching Bekasisa's Healthbeat. Thanks for tuning in. The United Kingdom introduced HPV vaccines in 2006, 8 years before South Africa. Today, the UK is virtually free of cervical cancer. So how do HPV vaccines work and how much do they cost? We break it down.
HPV virus is one of the commonest sexually transmitted infections that we have, and it's one that affects young people very soon after they have sex.
Professor Helen Rees is the founder of the Wits Reproductive Health and HIV Institute. She says HPV jabs are safe and over 90% effective against cervical cancer. HPV is the main cause of this type of cancer.
HPV as a virus has got over 100 types, but there are only a few of those types that are associated with cancer. When we develop a vaccine, we'd say what of those HPV types are very strongly associated with the development of cancer of the cervix, and the vaccine is then developed around it. It doesn't have the virus in it. It's got what we call virus-like particles.
Virus-like particles are tiny molecules that look like viruses, but they can't infect you because they don't contain genetic material of the virus they resemble. The tiny bits of man-made particles train your immune system to make antibodies that can fight the virus.
And in the future, if you get exposed to that real virus, the body says, I remember this, and immediately fights off the infection.
South Africa has two types of HPV jabs, Cervix and Gardasil 9. Cervix protects against the two most common HPV types that can cause cervical cancer. Gardasil 9 protects against 9 such types. Because people get HPV from having sex, the shots need to be taken before users have started to have sex.
There you go.
That's why South Africa's school vaccine program begins at grade 4.
Once you get older, much older, many women will have been already exposed. And so the benefit of the vaccine is more limited.
Girls at public schools get the Cervix jab for free. The government plans to introduce HPV vaccinations in private schools within the next 5 years. In the private sector, one shot costs between 1,200 and 1,300 rand. Each girl needs 2 shots.
And they are life-saving, literally life-saving vaccines.
After the break, we talk to an expert about how to curb cervical cancer in South Africa. Stay with us. You're watching Bekasisa's Health Beat, and we're talking about cervical cancer vaccines for young women. With me is Dr. Langanani Mbodi, the head of gynaecology at Wits University. Langanani, thanks so much for joining us today. What is the link between HPV and cervical cancer?
If you have to look at it, the cervix, which is also called the mouth of the womb, is constituted by 3 layers. There's a deeper layer, the middle layer, and the superficial layer. So we know that 99% of cancers of the cervix are from the HPV itself. So what happens is 99% of people who have sex, whether you use a condom or not, any other method or not, you'll have HPV. But 90% get rid of it because there's a good immune system. The way it works, HPV goes and infects the deepest layer and sits there. The longer the infection stays there, the more it infects more and more layers and more layers. And it changes the DNA of the cervix. And the cells now change and become abnormal. If they're allowed to progress without treatment, then they can become cancerous. You need a healthy immune system for you to fight HPV. So it means that the 90% of people with a healthy immune system are able to get rid of the HPV at early stages. The problem is the 10% that can't. You cannot have a healthy immune system when you don't have enough food, good protein, good nutritious food. That's number one. Number two, the prevalence of HIV. HIV, it almost goes with HPV, together with HPV. But HIV also affects the immune system. We've got a high prevalence of HIV in the country. It means that those women who are infected with HPV are likely going to have the HPV stay there, what we call persistence. The other part is what we think is the healthcare system failures. It's very difficult. Either access to prevention, to screening, or to treatment when the cancer is identified earlier.
So, talking about screening, one of the things women can do to pick up signs early is to have pap smears.
That's correct.
So, does the access to pap smears in the government system have something to do with Black women not being able to access prevention or screening fast enough?
Women will go and have a pap smear done, but time and again when they go, the results are not ready or they are not found. At some point, they'll be told, go and repeat another pap smear. And then they wait and they wait and wait again. Or when they go again, you get to be told that the person who deals with that part of the healthcare system is not available. So the truth be told that the healthcare system is also letting women down when it comes to screening itself and follow-up of the screening procedures.
How often can you get a pap smear in the government system?
We do it every 10 years. And ideally, do not start screening if you are less than 25. So currently, we are still on 10, 10, which means 3 times in your lifetime. But we are moving towards a 5, 5, 5, 5, which will increase to 6 times in your lifetime.
And that's very different from the private sector, right? Where women generally go once a year for a pap smear.
Yes, in the private sector, people are doing it every year. But I think we need to reassure your viewers that doing it every 5 years, as compared to the ones who are doing every, does not put you at a disadvantage at all.
So why is it so important to get vaccinated then? And when can you get vaccinated?
Naturally, a vaccine prepares your body to fight against the enemy before it comes. Remember, I said your immune system in the cervix is important. So the vaccine will prepare the immune system on the cervix itself, so that by the time you get that HPV, because again, 99% of people will get it anyway, so that the immune cells are prepared, so that you eliminate it. If you eliminate it, it means we are increasing the pool. Remember, I said 90% of people have a competent immune system naturally to get rid of it. So if you can give a vaccine, you might increase that pool to almost 100% of people to get rid of it. An example is there in New Zealand and Australia. They've almost eliminated cervical cancer because of the vaccine.
What type of cancer can boys or men get from HPV?
In the majority of things, we say men or boys are carriers. If you go back to what I was explaining, they bring the cancer. But we have not seen a lot of incidences of penile cancer from HPV as yet. But for boys who have sex with boys, they will have penile cancer, rectal cancer, or colon cancer from HPV. Or those who indulge in oral sex, then they might have a throat cancer. On its own, it's a little bit rare to see penile cancer as compared to cervical cancer. So boys can have cancer. And it makes sense that we must not treat the victim, we must also treat the perpetrator in this regard. So if we are giving a vaccine to the girls so that they don't die from the cancer, why don't vaccinate the boys so that they must not bring the HPV to the girls as well?
Is cost an issue? Is that why we're not vaccinating boys?
I think in our country, initially, yes. The biggest disadvantage is we are consumers, we are not manufacturers. However, my personal belief is it's not cost. I think this disease is political. Let me give you a scenario. If cervical cancer was affecting men, we would have long gotten the vaccine to every single living human being in the country.
Let's say you do get cervical cancer and you're a woman, of course. What happens? What can the government hospitals do for you?
If you do have cervical cancer, if it's an early stage, for example, cervical cancer stage 1A and 1B, we know those ones can be operated, you remove the womb, and then you get cured. Anything above that says you must get radiotherapy or radiation. Whereas if it's advanced and then it's late, then we have to give you treatment so that we control the pain, the bleeding, the comfort, so that your quality of life can improve. Currently in government, you can get all the management strategies. If you have cancer already and it's early, there are services for operating. If it needs chemo, you can get chemo. If it needs radiation, you can get radiation. However, access is limited because of the numbers that are there. There's a lot of women who are waiting for surgery, a lot of women who are awaiting radiation, a lot of women who are waiting chemo. To give you a perspective, ideally, you will say, I want to operate this patient within 2 weeks of diagnosis. Diagnose, operate in 2 weeks. What are we doing? Diagnose, operating 3 or 4 months, which is not ideal at all, none at all.
So if you look at this late access to services, what's the survival rate in the government sector for cervical cancer?
Ideally, you say you want the survival rate to be about 80 to 90%, which means 80 to 90% of those that you diagnose, in 5 years, you must find them alive. We are sitting at 60, sometimes less than 60. So because of the same thing, the ones that we diagnose now, by the time they come, in 3 months, 4 months, if today we had said you are 1B, the stage 1B that needs to be operated, when you come, of course, for admission for operation, we have to reassess you. In most cases, we find that because we are waited for long, by the time they come, they're no longer operable. So we need to book them for radiation and chemotherapy. And when they go there, they are going to join another queue. And their waiting period is also the same 3 to 6 months. So if you can convince those who are against NHI and say that the advantage with NHI, we think it might work when it comes to cancer in this way. The reason it's not working is because we don't have access to theater. So you'll have one theater a week. In private sector, theaters are full, underutilized. If we can source those services there, in private sector, theater staff are there, doctors are there. There are more doctors in private than there are in public. They are there who can operate. Of course, even now, before NHI is there, if private sector can open up and forget about this business idea that they have about the cancer and say, we want to help, we'll charge you a minimum fee to access theater. And as government, come and operate. The doctors will flock in there, then we'll kill that waiting period. We can kill it and such that we can see a person today, in 7 days we are operating. And we are convinced that will improve the outcome with cervical cancer on women in the country.
Langanani Mbodi, thanks very much for joining us today.
Thank you. You're welcome.
There you've heard it. No woman should die of cervical cancer. We've got the means to beat it and to avoid surgery. That's your Health Beat. Thanks for watching. Stay well.